most issues we're talking about today is the most important issue facing America, the incentives of our biggest industries to profit from drugging our kids and then after poisoning them. On the bottoms up, I think a bottoms up revolution is happening. I mean, if you get outside the corporate controlled media that's totally bought off by pharma, we're all gravitating to information to be healthier and to get our kids healthier. I mean, the most popular podcasts, you know, from Joe Rogan on down, are essentially chronic disease, metabolic health podcasts. I thought this guy was crazy during COVID, you know, with all the bad information about him. I tune in, he's talking about exercising, looking at the sun, you know, eating healthy food. I'm like, this is pretty radical stuff. He was enemy number one from the NIH, leaked emails. But the podcasts represented around this room, the books, Americans want to be healthy, and just, you know, I think there is a bottoms-up revolution happening, but I think we need to, especially in this room, be clear. We cannot go on existing as a species if our largest institutions, our largest industries have co-opted our institutions of trust, our regulatory authorities, our government itself, and continue to profit trillions and trillions of dollars from us being addicted, from us being in fear, from us being sick. We have to have top-down change. And just speaking with bipartisan leaders and speaking with Bobby, I mean, I do think, and I think we all need to get this in our heads, it's not complex. It just takes political courage. A fundamental tenet of our healthcare policy is we need to trust the American patient wants to be healthy. We need to have faith in the American patient, and we truly just need to do two things. We need to, number one, get corruption out of medical guidelines, and number two, open up healthcare flexibility. Let me just talk real quick about those two. Get corruption out of the medical guidelines. Americans listen to their doctors. When the Surgeon General, too late in the 1980s, said smoking was bad, smoking rates plummeted. We followed the food pyramid. We follow the vaccine schedule, by and large, for better or worse. We listen to medical authorities, and institutions that want to profit off sick kids have learned that and completely co-opted our medical institutions. As a simple statement of economic fact, the pharmaceutical industry is the largest funder of news. They are the largest funder of medical research. They are the largest funder of medical schools. They're the largest funder of civil rights groups, believe it or not. They are the largest funder of politicians themselves. They spend 5 times more on political donations and public affairs and lobbying than the oil industry. So the pharmaceutical industry, just as a simple statement of economic fact, has co-opted our institutions of trust. What do we need to do? We need to not get into complex policy debates, because that is where evil hides. We need to have simple actions one by one. We need to to disallow USDA officials who make nutrition guidelines for our children to take money from food companies, period. Every American listening would assume that's already the case. It's not, and it's a huge problem, and that is why added sugar is part of a healthy diet for a 2-year-old, according to the USDA guidelines. We need to reset the NIH's founding mission to do foundational research on why we're getting sick, not be an outsourced R&D lab for the pharmaceutical industry. Everyone would expect this is already the case. The NIH, 90% of the funding is on incremental cures. They're not studying why we're getting Alzheimer's. They're studying marginal, ineffective drugs for Alzheimer's. We have to have population-wide studies to understand why we're getting sick. That should be the full focus of the NIH. Why is the FDA funded by the pharmaceutical industry? I've spoken to member after member who are very concerned about that in this building, but they slide it in. Why is pharma lobbying to pay billions of dollars out of pocket to fund their own regulatory agency? I've talked to healthcare staffers who support this for whatever reason and said, oh, it's a money saver. It's $3 billion. $3 billion, as if this building cares about $3 billion. That's $3 billion that we could have the taxpayer pay to not allow the agency that regulates drugs to be co-opted by the agency, by the industry that's trying to regulate. That would be $3 billion well spent. The FDA should not be funded by the pharmaceutical industry. I've been in DC long enough to know that institutions are built to grow, and if the incentives of a bureaucracy is to grow as the pharmaceutical industry grows, and there's zero conflicts of interest rules about the FDA commissioner going straight to the board of Pfizer, it creates really bad incentives. We have to just untangle the FDA from the pharmaceutical industry. And number two, we need to disaggregate the F and the D. Why is the pharmaceutical industry funding the institution that oversees our food? We need to do these simple things. One other is SNAP. It is absolutely suicidal public policy that with the program that lower-income Americans depend on for supplemental nutrition, that 10% of that goes to sugary drinks and 70% goes to ultra-processed food. We are underwriting the poisoning of our lower-income population, and then Medicaid picks up as a lifetime annuity to pharma. We are spending more on mitochondrial dysfunction, diabetes and related conditions, just on Medicaid than the entire U.S. defense budget is going to bankrupt our country. It's destroying our human capital. It's not working. We should not be subsidizing ultra-processed food for children. The last, and just on this corruption, very importantly, is that the pharmaceutical industry is able to buy off our information sources. We are the only country essentially in the world that allows that. During COVID, there was zero curiosity about why we were dying at a 3 times higher rate than any other country. When you listen to independent media, all they're talking about is the exploding rates of chronic conditions. There is never a segment. CNN, NBC, Today Show, they will not have my sister and I on. We have a book about medical empowerment. They won't have any healthcare author on that even questions medical orthodoxy. I've talked to the producers. They said, no fly zone, because it would go against who's paying their bill. It is not liberal, it's not conservative to say that we should not have an institution that just fundamentally profits from Americans being sick, being able to buy off our information sources. So, getting corruption out of the science, we need to fearlessly get back to science and start just asking and answering basic questions. Is glyphosate safe? Are these food colorings safe? Is it appropriate to give a child a shot 3 hours into life for an STD? These are... If we have the science right, we need to just trust the American people then to make the right decision. They are clamoring for information, and that needs to come from the medical authorities, and that can happen very quickly. Number two, very quickly, if we have the right medical information, we have to get to flexible healthcare accounts. We have a top-down system where if you're on Medicare, you're on Medicaid, you're on mini insurance, we actually mandate through law that it's a one-size-fits-all system. Most doctors don't even realize that they can write a letter of medical necessity recommending food, recommending exercise, that then opens up tax advantage spending, often on HSAs and other flexible spending accounts. Casey didn't learn that at Stanford Medical School. Doctors are simply trained to write a script, to, in a 15-minute appointment, name the condition and drug it. We need to open up flexibility. We need to get the right information, just the clinically right information. The clinically right information that heart disease is not a statin deficiency, that metformin is not, that diabetes is not a metformin deficiency, that depression is not an SSRI deficiency. We need to open up and listen to Dr. Palmer, listen to the other doctors here, realize that disease is interconnected, have that research, and then have the flexibility in our healthcare dollars for patients to work with doctors to choose the right intervention, which often involves food. I hate when food is talked about as this lifestyle bucket or this prevention bucket. Food clinically and exercise and these basic metabolic habits are clinically the most effective reversal, the effective treatments for the chronic conditions that are plaguing our industry. We need to stop talking about these fringe food as medicine bills. We need to stop talking about these fringe prevention programs. It needs to be the center of healthcare, regenerative farming, transforming our food system, exercise. That is healthcare. If we can get the right medical guidelines and trust the American people to make the right decisions with their doctor and have flexibility in where their healthcare dollars go, we will be a transformed country. Senator, thank you so much for convening this incredible discussion. And I'll just end to Jason's point. We should be optimistic. What other country allows people into hollowed halls like this to absolutely savage the institution itself and big industries? This does not happen in China. This is part of the process. The seemingly monolithic structures we're going against, I think, can change very quickly with leadership here and leadership from outside. Thank you, everyone, so much for being here.
Well, again, thank you, Callie, for assembling this panel. Dr. Means for being the inspiration.